So this is an overview of Charting the Life course, and I say that it is just an overview. And I include person-centered thinking because we are all mandated to be person-centered. That's been in rule for probably 20 years or more. And Charting the Life course and person-centered thinking are complementary. So my name is Barb Safaris. I work for the Family Resource Network of Ohio. We are Ohio's official hub for Charting the Life course. We hope that you will log into our website, www.frnohio.org, and that you will sign up. There's a pop-up and it'll say, do you want to sign up for notices? We offer many opportunities to learn about Charting the Life course. As I said, this is just an overview. We do very specialized trainings focusing perhaps on a life stage, a life domain. On Monday, I'm doing a Lunch with Life course, just sharing some of the 11 different trajectories that you can use as you are supporting and empowering people and families. And we hope you like our Facebook page if you are a Facebook user, because we post stories of how people are using Charting the Life course to support and empower people and families across the lifespan, across service systems. So not just DD, but education, mental health, physical health, juvenile justice. So we hope you like our Facebook page. We can provide all these opportunities without cost because of very generous funding from the Department of Developmental Disabilities and the Department of Education and Workforce. We have a team at Family Resource Network of Ohio. Tracy Manns is our project manager, and Erica Young, who is on the call, and she can wave, is our project manager coordinator. She will be monitoring chat. She will be putting resources in chat. She has included a link to the handouts if you did not get them. So I hope that you will see and get those handouts and save them because they will be useful as you work with people and families. My name is Barb Safaris, and I'll talk a little bit about myself, and our other team member is Celia Schlomer, who is from the Cincinnati area. So for those of you that don't know me, and I see some of my former coworkers from Cuyahoga on here, so hello, it's good to see you. I had two younger brothers. My youngest brother, Nick, had a developmental disability. My middle brother, Jim, had an acquired disability. So in his 30s as a result of an accident. Both of them needed supports on a daily basis. Retired from the Cuyahoga County Board, worked there for 36 years in a variety of roles. And I have been consulting for over 15 years. I do a lot of presentations on Charting the Life course. I'm a member of the national team, and I am a mentor trainer in the learning community for person-centered practices. You have 7 handouts. As I said, if you did not get the email with them, Erica has put a link in chat. I strongly suggest that you save them to your hard drive or whatever. And I know you will find them helpful to use in the future. They are also, not the PowerPoint, but the resources are also on the internet. But it's easier to find them if you just save them to your own desktop or wherever. So let's set the stage. Again, we will give CEUs if you attend for the entire 3 hours, just like you are expected to do when you attend an in-person training. You don't get CEUs if you if you come in late. You are expected to be on time and stay the whole time. We will take a break about halfway through for about 10 minutes. There will be breakout rooms, and you are expected to go into the breakout rooms and participate. And if you have any questions, please, there are 57 of us on the call. Excuse me. So please type them in chat. Erica will be monitoring chat. If she can answer the question, she will. If not, she will unmute, call my name, and tell me there's a question and share it with me. Erica has also put in chat the requirements for getting your CEUs. So again, attending the whole session, participating in the breakouts, and at the end, filling out the survey, which will ask you if you want CEUs, what is your email address? And we do get a report from Zoom. So you need to attend all 3 hours. So today will be an introduction to the principles and framework. I will share some of the most common tools from Charting the Life course, and I'll share some of the common language. Those of you working in the field of IDD, you know that the domains are on the Ohio ISP. Charting the Life course is not in the Ohio ISP, but the domains are. So hopefully, as I share the tools and resources, you will see how they will help you get the information for the OISP. A little bit about Charting the Life course, the framework. There are 8 principles. I will share them with you. On the left, you see that we use icons. We want Charting the Life course to be accessible to all, so we try to use common language and icons. Charting the Life course was developed by and for people with disabilities and their families. It was developed at the University of Missouri, Kansas City. And we, Ohio, is part of a national community of practice supporting families. And what that means is we have the opportunity to hear and learn what people are doing in other states, and also to share what we're doing in Ohio. So I love the fact that we learn from other states. You know, we're great in Ohio, but we don't know everything. And so to be able to learn with other people is really just very empowering and has helped us support and empower people and families. We also have a community of practice. We meet quarterly. You can sign up on frnohio.org for updates. And a community of practice is a group of people who are passionate about something. We're passionate about supporting and empowering people and families. We believe that you need to come together, share your learning, share what you're doing, and learn from and with each other. So we have community of practice meetings quarterly on Zoom. We also are looking forward to scheduling at least one community of practice in person during the next year. So please sign up. It's a great way to hear what other people are doing and say, oh my gosh, I never thought of that. And sign up on frnohio.org. We have a trajectory. Trajectory is one of the tools for supporting and empowering people with disabilities and families to use Charting the Life course in Ohio. We want people and families to know about the tools. We do a lot of sharing of information with people and families. If you have a group of self-advocates or a family group and you, after today, you think, boy, it would be nice if they knew about this. You can, oh, I see Erica has put our website and how to sign up, but you can also contact us and say, I have a group who I think would be, you know, love to hear about this. Can you make a presentation? So please share, and we're happy to share information with any group throughout the state. We can do it virtually, which makes it easy for everyone. Sometimes we can do it in person, but we've got, there's got to be, we'll have a conversation with you about the best way. We also want professionals to know about charting the life course. We know that using the tools and the principles help you do your work and help you get the information. What we don't want, just as important as identifying what we do want, is what we don't want. We don't want people to say, oh my gosh, here's more forms I've got to fill out. Or that families share what they've put together and staff go, that's nice, I'll put it in your folder, and don't use it to develop the plan and identify how to support the family or the person to have the life they want. So if you could, can you type in chat why you're attending today and what you hope to learn or what you hope to get from this 3-hour session? Learn more about the tools, improve the support I give to the folks, learning more about the process, reinforce best practice. Thanks, David. Help my families see new tools and how to use them. Tools and tips to help focus on strengths. That's a great point, Chelsea. We are a strengths-based approach. Our focus is on supporting people to have the life they value or a good quality of life, not to address their deficits. The structure of the program and how to apply it, use more tools, support families and children in districts. Oh, great, Kimberly. Thank you. A refresher for you. Okay, Jen. Help implement them in my work, transition. Oh, yes, 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 lots. And you know what, Paul, we may do a session in the future just focused on that life stage. So look out for that, because then we would focus more on specific tools for supporting students in transition. Okay, support your brother and the individuals you work with. Yes. And I'm just going to say that I've used the tools and resources in my own life for me personally, but for other family members who do not have disabilities. Support your 18-year-old son, Empower Me Living. Housing solutions for people with IDD in Cincinnati. Great, great. Oh, that would be great. And we would be happy to talk with you, Sam, about how we can support you to do that. Awesome. So lots of family members. I'm so glad. I'm so, so glad. Wanting to learn how to integrate this in your teaching practice. Okay. Better support families, growing career as an SSA. I know it's a difficult job. I was one. Oh, we're so glad to have you, Maria from NAMI. Awesome. Okay. It is, I'm so glad you're saying that. Wow, Vivian, you are not from Ohio, are you? I don't recognize Charlotte or Rutherford, so I don't know where you're from, but welcome. We're glad to have anybody and everybody from wherever you are. Thank you for sharing. I hope to give you some things that you can do right away. And I will encourage you to, number one, practice on yourself. Families and people are not guinea pigs, so don't think that just because you attend something for a couple hours. Charlotte, North Carolina. Oh, thank you, Vivian, for attending. Oh, yes, yes, to support the Hispanic families. That's awesome. Yes. And please know that the resources, there are some of the resources for charting the life course in Spanish on lifecoursetools.com. So some of the tools have been translated and are available. Our core concept in Charting the Life course, our why do we do this, is that we want everybody to have the right to live, love, work, play, learn, and pursue their life aspirations in their community, whatever their community is. We want everybody to have a good life. And so we want people to have self-determination. And let me define self-determination. For me, we know self-determination has many meanings. It's a service, it's a funding, but for me, I'm talking about the civil right. And self-determination is having control over decisions affecting your life. Now, some of you may say, but I work with people who can't make informed decisions, but they and their family can. And so our role is to make sure that we support self-determination, giving people control over decisions affecting their life, not just asking them to agree. Do you want this? Do you like this? That's just asking for agreement. You see that we use the term interdependent, not independent, because none of us is independent. So why do we expect people with disabilities to be independent when none of us are? We all depend on other people. We do not do everything for ourselves. And if we don't, we pay people to do those things, like mechanics and contractors and people, landscapers and beauticians and barbers and all sorts of people. None of us is independent. And we want families to be supported in a way that recognizes their strengths, their capacity, and we support them so they can turn around and support the people they love. And that is critical because we know in Ohio that about 75% of people with IDD live with family. Especially for professionals, I like to put this Rehab Act of 1973. You see, it is 51 years old. It is the first time that disability is recognized in federal legislation. And look at the sentence, disability is a natural part of the human experience. Look at the rights of people with disability that are listed in the Rehab Act. For those of you that may be veterans like myself, and I mean veterans being working in the field for a long time, I've worked in the field for almost 50 years. The rights include self-determination, which is different than making choices, and full inclusion and integration in American society. Please note that before 1974, people with disabilities could be excluded from public school, and this is the law that families used to fight for 94-142, which was the Education of All Handicapped Children that passed in 75 and led to including children in public schools and the IEP. So children have only had the right to go to school for approximately 50 years. They were excluded before. So I talked about this as an overview, not only of Charting the Life course, but also person-centered thinking. We know that Charting the Life course, person-centered thinking, Medicaid guidance, and Ohio rule say that we should support people. We should empower them, which means giving them tools and resources to increase their control, that we should help them become valued members of their community, not just that they visit the community, go to Walmart, woohoo, but they belong, and that they have a life they value. So common functions across systems, whether you work for education, DD, mental health, physical health, juvenile justice, adult justice. I'm trying to think of who else we've had attend our sessions. We all need to discover, or that ugly word, assess, which is the word on documents. We need to plan. We need to implement. We need to review, how's our plan working? Are we helping people have a life they value? We need to help people find resources. We may need to recommend or authorize funding and services. We need to problem solve, and we need to facilitate, communicate, and collaborate. Part of my professional career over, gosh, I'm trying to think of how many years, 25, 30 years, I was a speech language pathologist, and I had to do all these things. So you don't have to be an SSA to do these functions. You could be a teacher. Oh, thank you, Erica, for putting the link for, did you put the link for the tools? Yes, in Spanish. Thank you, Erica. I appreciate it. But we all have to do this. If you're a teacher, you have to discover what is that child's or the family's vision. You develop a plan, you implement it, you review it. You've got to help them find resources, not just programs, but if you look at the rule, when you're looking at transition, you're also looking at what's available outside of the school and what opportunities can be provided outside of the school setting. So we all have to perform these functions if we are supporting and empowering people and families. So charting the life course is about having conversations. It's about having different conversations. We're not asking, can you, but we're focusing on quality of life. What kind of life do you want? We also encourage high expectations. So we should never say to somebody, no, you can't, but we should be having in-depth conversations. So my classic example is a young man who told his team that he wanted to be a pilot. And immediately people were like, you can't be a pilot, you can't read, you don't know numbers, you never went to high school. And his job coach said, so tell me more, why do you want to be a pilot? And he shared that he had been placed in a state institution as a child, but he remembers as a young boy going to the local airport and seeing his father who flew small planes, not commercial jets, and waving to his father. And so he wanted to be a pilot. The job coach said, you know, we have a local airport. Let's go see if there are any jobs. And they did. They went to the local airport, talked to the manager of the airport. And the manager said, I don't have anything. Job coach handed him his card, said, if anything comes up, you know, let me know. His father was a pilot, you know, he might like working at an airport. Job coach got a call a month later. I have a job for maintenance. He said, I'll call the gentleman and ask him if he wants to come out and learn more about it. He did. He got the job. He went from just doing maintenance to being the one who drove that little cart out to the planes and unloaded the cargo. So the pilots loved him. He talked to them. He said, when am I going to see you again? So encouraging the high expectations and looking at how we can help people reach those expectations or be in an environment where they can have those experiences. We also know it's important to have experiences. How do you know what you want to do if you've never done anything? That's why part of the transition rule in education is giving people experiences, seeing what they can do in the community. What can they learn? You know, how do you know what you want to do if you've never done anything? And then looking at not just receiving supports from the system, but 4 other areas, and I'll talk about that. So this isn't just about the tools. It's not a program. It's using the resources to facilitate conversation, to empower people, and then to use the information to develop your plan so that you help people have a life they value. Now, people will tell me, but I work with people who don't talk, or I work with people who have dual diagnosis, or I work with people who, there are no exceptions. because with all person-centered approaches, you get the information from the person, from their words and their actions, and from the people who know them the best. Now, I was a licensed speech language pathologist for 45 years. I never met anyone who did not tell us what they like, what they don't like, what they want, what they don't want with their words and actions. Never. And when I first started working for the Cuyahoga County, we had 3 state institutions in our county. And those people, many of them did not use words in any way, spoken, signed, pictures, and yet their staff and their families could tell me what made a good life, what they liked, and what they didn't like. So there are no exceptions. If you're working with youngsters, babies, early intervention, which no one seemed to indicate they do, but small children, we're getting the information from the child, because remember, we ask every child we know, what do you want to be when you grow up? And also from the people who know them the best, their parents. There are 8 principles in charting the life course. We know, not we believe, we know that that charting the life course is helpful for all people, with or without disabilities across the lifespan. We recognize the importance of family systems and that families go through cycles, and what they need may change because of what's happening in the family. So think about in your own life. If someone in your family passes away or becomes very ill, it changes what the entire family needs. If someone loses their job, it impacts the entire family. We believe that people should have a trajectory or a vision of the life they want across life stages, that it is important to identify life outcomes, not skill goals. That's part of, but skill goals related to life outcomes and experiences. We talk about the 6 life domains, which are headings on the Ohio ISP 6+ communication, which is something Ohio added. We'll talk about 3 buckets of supports, that we all have needs, and as professionals, we should be filling those 3 buckets and providing that support. We'll talk about integrated supports, looking not just at the system, but at 5 areas or 5 points of the star. And we believe that people with disabilities and their families should be involved at a policy and systems level, not just being updated on what's happening, but they should be decision makers. We believe that all people exist in the context of their family, and family can be biological or chosen. Those of you that have heard me before know that I am Greek American. I call people uncle and aunt. I call them terms of familial terms. They are not related to me. However, they are considered family. There is no blood relation. And so we need to recognize, instead of just saying, well, they have no family, looking at who do they consider family, and knowing that the family needs support just as much as the person. Oh, and just a point. Please don't make the assumption that their family lives out of town, so they're not engaged and involved. With Zoom and electronics, trust me, you don't have to live close to be involved. And please do not judge family involvement by their attendance at a meeting. I hate to break it to the professionals, but we as families don't really like our meetings. They're really not very positive. They take a long time, and don't assume engagement because someone does or does not attend a meeting. You know, I love asking families, how long is your ISP meeting? And I'll never forget, a mother said to me, 3 hours. I said, 3 hours? She said, yes, Barb. My daughter's been known to the county board for 20 years. All she gets is day programming and transportation. She lives with her dad and I. We do everything else. We take her to the doctors. We, take her to the Special Olympics. We do everything else. Our meeting was 3 hours. And she goes, that's 3 hours I'll never get back in my life. And my comment to her was, if someone was in my house for 3 hours, they better bring a bottle of wine and food, because that's the only reason you're going to be in my house for 3 hours. So remember, we focus on the person with the disability, but we also have a holistic approach of looking at the family. So it's not family versus person, but it's the person in the context of family. So I know there's a lot of conversation about age 18, and we can't talk to the family, and we can't include them because they're an adult. And what you need to ask people and say to people is, who do you want in your meeting? And you can have anybody you want, including your parents. Not, we can't talk to them because now you're 18, but who do you want? I am a sibling, and I would be remiss if I didn't also talk about the role of siblings, that we are often called the club sandwich generation, because we may be taking care of older parents, we may be taking care of our siblings, and we may be taking care of people in the third generation, our own children. So if you are working with families and there is a sibling who is an adult that is providing support, one way that you can help them connect with other siblings is tell them about the Sibling Leadership Network closed Facebook page, which is called SibNet. We recognize that people in families have reciprocal roles, that we care about each other. You see the icon of a heart, and that's because that's the emotional caring. Yep, parents, siblings, children, and grandchildren. Oh my gosh, my anxiety level just raised for you, Hannah. So 4 generations, oh my goodness. And then caring for, which is often represented by an icon with a shield or a person with a roof over their head. And those are the physical caring. Those are the caring that often we can get paid services. The emotional caring about are those emotional. We cannot usually pay for those. That's usually people who know people well. But we believe there's reciprocity. So the person in the family cares about others, and they care about them. They may care for people in their family, and people in their family care for them. So in my experience, I often worked with adults who were in their 60s living with their 80 to 90-year-old mothers. And there was reciprocity. The gentleman with the disability was not just on the receiving end, but they were also caring about and caring for their mother. The one gentleman drove her to her hair appointments, her doctor's appointments. He took her grocery shopping. And we break down these roles so that we can help people think about who can do one of these things, instead of the way that families typically look at roles as who can take over and do everything I'm doing, but who can do one part. I also do a training where I just help families look at reciprocal roles and what that means. I talked about one of our principles being the 3 buckets. So we all have needs. Think about when you got a new job. You got information about that job. Maybe you read the job description. Maybe you connected that orange bucket with people. Maybe you talked, if you're a new SSA, maybe you talked to SSAs and said, hey, what's it like being an SSA? What's the job like? Maybe you talk to people who work for that agency to say, what's the culture like? How do people treat you? How does supervision happen? And then you looked at goods and services. What do I need to be able to do? Or what do I need to learn so I can be an SSA? You do this when you do other things, buying a car or whatever. You know, you get information. What do I want in a car? You look at goods and services. What kinds of cars are available? What do they cost? Will I get a loan? Will I pay cash? Will I buy new? Will I buy used? Will I lease? And then connecting and networking, asking other people, do you have this kind of car? What do you like about it? As professionals, knowing that these are the needs that we all have any time in our life, how are we filling these three buckets? How are we giving people information? How, you know, do you have a website? Do you have a newsletter? Do you have a Facebook page? Do you use social media? How are you sharing information about what may help them work towards the good life, not just from your agency, but what's available in the community? I just did a presentation this week and talked about how everything cannot be paid through public dollars. So what are the other resources in the community? Are there other agencies that will provide that support? I was sharing that when my mother and partner had dementia, they could read, they both could read, but they needed reminders constantly. Like they didn't know the difference between 3 a.m. and 3 p.m. And so I Googled and I found a clock that would actually, I could set to remind them, take medication, but it also told them the day of the week, the date, the time, and what part of the day it was. It's morning, it's afternoon, it's evening, it's nighttime. And I did not have to be the nag and remind them 100 times a day. It costs $60. And someone in the audience said, but you could pay the $60. I said, yes, I could. And I said, so who out there in the community would be willing to pay for the $60? You know, well, we can't pay for it in our agency. I said, your agency needs to think about that $60 saved me emotional health. And it also saved me having to hire someone to remind them to do those things. There are also lending libraries. If people belong in their community may be willing to help them, like their faith-based community, or if they're part of a club. And don't, you know, there are families who use GoFundMe so they can fund equipment that maybe their insurance won't pay for. We all need to broaden our knowledge of what's available to support people, not just what we can do in our agency, but what's out there. So let's talk about words. We know that our words convey our values and beliefs and our prejudices. So when we talk about people, are we talking about their deficits or their qualities? Are we talking about how needy they are or how they contribute? Are we talking about the fact that they're not independent, or are we talking about how interdependent they are? What are we trying to communicate? Are we communicating their needs or how to support them? So let's look at the words we use. Think about the words you write in your report, in your reports. I love asking families to describe their person. Tell me about your loved one. And they usually use the same sentence. I have a son, daughter, brother, sister who is X amount years old and has ABC disabilities and goes to day program or school and lives with my parents in a group home, whatever. And I'm like, thank you very much. You just told me what made them eligible for services. Now tell me who they are as a human being. And anybody recognize the one thing nobody tells me? Any ideas? No one ever tells me the person's name. And if you don't even talk about the person by name, All you're doing is talking about an entity. You're not talking about a human being. So yeah, wow is right, Deborah. Think about how you describe someone on your caseload. You know, do you start talking about their needs? Oh, no. Oh, that's my pet peeve. And I hope I say your name right, Kelly. I have mispronounced someone's name on this call multiple times, and I beg forgiveness because mispronouncing names is a real pet peeve of mine. So yeah, that's terrible. They don't even know his name. Oh my gosh. So they don't even see him as a person. Oh my goodness. I love your comments, everybody. Yeah, every time it's not that hard to get his name right. I had to actually start writing people's names in phonetics so that I would pronounce it correctly. And, you know, I grew up with people who never could say my last name. So for me, it's like I had somebody deliver one of the delivery services, and I was on a Zoom call and I didn't go to the door. And when I went to the door, he had stuck a note that says, "I missed you, call me to pick it up." And he goes, "You just came in time." And yeah, correct yourself. Exactly. And he pronounced my last name. He goes, "Are you Barbara Safaris?" I think is what he said. I said, "Yes." He goes, "Did I say it right?" I said, "Close enough." I said, "I'm not used to anyone ever saying it right." So, so I said, "But that's good. That was a good try." So this is the portfolio. It is one of the most common tools that we share with people and families, people with lived experience, self-advocates. It is really made up of 3 tools, and I'm going to take you through each one. On the front is the person-centered description. It's 1 page, okay? And that's the key. It's 1 page. If you have referred to this as a profile, please do not use that word profile. Several groups have told us that profile is an offensive term and they do not want to be profiled. So that is an old term. If you are using it, please change your language. Again, language conveys values. The 1 page person-centered description, or 1 page, really talks about who the human being is and not their disability. In fact, it's probably nowhere on the 1 page. It is not the same as the introduction page on the ISP, on the Ohio ISP. So if you are an SSA and you say, "We already do this," you're only doing it if you use these 3 sections. So I'm going to go through each section. I have 2 templates. You don't have to use the templates. In fact, I prefer that people use a Word doc. This one has the 3 sections. This has the 3 sections plus a place for a photo. So let's look at what the 3 sections are. The light blue heading is, what do people like and admire about you? And these are qualities. These are not activities. So a lot of times people will tell me, "Well, I'm in Special Olympics." I go, "That's great. That's what you do. But who are you? What makes you passionate about being in Special Olympics?" And they're like, "I don't know." And I'll say, "Well, are you athletic?" And they go, "Yes, I train." I said, "Okay, the quality that you have is you're athletic. Are you competitive?" What does that mean? "Well, do you want to win?" "Well, of course I want to win. I want to get the medal." "Oh, okay. So you are competitive." And I say this because a lot of times we have never talked about people's qualities. We talk about what they do. And people cannot tell us their qualities, which I think is so sad. Another gentleman works for a nonprofit. He designs flyers and social media information. And he asked his boss, "What do you like about and admire about me?" And he said, his boss said, "You make nice flyers." And he came to me and he said, I asked my boss, and he said, "I make nice flyers." I said, "That's what you do. But what's inside of you that helps you make these beautiful flyers?" And like Erica makes beautiful flyers. I am so glad she makes our flyers because I am not creative, not in that respect. And he said, what do you mean? And I said, well, if you make beautiful flyers, I'm guessing that you're artistic. You know how to put colors together and make them look nice. He goes, well, I am. I said, oh, okay, that's your quality. What else? And he goes, I'm not sure. I said, you're creative because you don't do the same thing every time. And he goes, oh, no, I do different things and blah, 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 blah. So we may have to help people identify their qualities. Here's a list of qualities, and in chat, type 1 or 2 qualities that people would say you have. So what do people like and admire about you? I'll give you a couple of seconds to type. I love it, love it, love it. Oh, you guys are fast. Oh, driven. Okay. Okay, Eileen, I love it. Kind and loyal, kind, respectful, caring, kind, enthusiastic, compassionate, resourceful, organized, trustworthy, warm-hearted, dependable. Awesome. Thank you, everybody. Oh, thank you. That's awesome. Awesome. Generous, friendly, loyal, determined, dependable, reasonable, passionate, good listener, ambitious. Thank you, everybody. Thank you for participating. I really appreciate it. So think about the words you just used to describe yourself. Those are the kind of words that we want to elicit from people, from the people who know them, or help them identify. We may have to tell them, people who tell me, but I asked them and they said they make pretty flyers. I'm person-centered. I write what they say. Yeah, that's great. But person-centered is also that you help people understand so they can give you informed information. So helping people realize their qualities. The second section is what's important to you. And I'm not talking about preferences, okay? I like Diet Pop. I prefer Diet Coke. I really like Diet Dr. Pepper, but they are not important to me. It's not important to me to have those. Important too are the things that if they were missing in people's life, it would impact their quality of life. Now, I always, for those of you that have been on sessions, I always have a water bottle with me in front of me when I'm on a session. Erica and I joined the call about 15 minutes ahead of time. And she said, so are you ready for 3 hours? How's your voice going to hold up? I said, I got my water bottle. I think I'm good. I may not want to talk for the rest of the day, but it's important to me to have this water bottle in front of me when I'm training. Okay, so there are 8 areas in person-centered thinking. Yes, Loretta, my coffee is important. And it's my coffee, not Dunkin' Donuts, not McDonald's, and not Starbucks, but my coffee. So in the past month, I have been out of town training 4 weeks in a row. And I did not fly anywhere. I went out of state, but I drove. And I packed my 4-cup coffee maker, my Yeti coffee mug, and my coffee, because I did not want to have to get up and not have my coffee. So yes, Loretta, my coffee is important. It is so important. I pack a coffee maker with my coffee. So, I haven't gotten there yet, Hannah. I don't grind my own, but okay. I love it. I love it. So that's what's important to people. And they will typically tell you what they do. I go to Walmart, whatever. But that's not important. That may not be important to. What is truly important to people? That if it were missing, their quality of life would be impacted. People tell us what's important to them with their words and behavior. And behavior, I don't mean negative, I mean their actions. Let me correct my language so we don't go down a path. On the ISP, You also have to identify important for. Now, these terms have been in rule in Ohio for, I mean, I can remember seeing important 2 and 4 in the old ISP rule from before 2000. And it's been in Medicaid guidance for over 15 years. Important 2 is what the person tells us. So if they say, it's important to me to not feel bad about myself, that's a health and safety concern, but because they said it, it's important to them. Important for is what other people say. The doctor, the family, maybe the provider, maybe justice system, the psychiatrists, psychologists, counselors. What's important for health and safety and what's needed to be seen as a valued member of the community. So think about, it's important for people to know how to engage in the culture of a workplace, so they know what are the rules of the workplace. We don't talk about important for when we talk about a one-page description, because that's focusing on meeting mostly deficits. What we're focusing on is who is this person? Who is this human being? So it is not like the introduction page on the OISP. Oh, you pack your Keurig. I think at some point I'm going to have to look at a Keurig, but right now my 4-cup stainless steel coffee maker even survives a plane trip. So I think I'm going to stick with that. So when we talk about being a valued member of the community, what does that mean? It means people share their gifts of their head, what they know, the gifts of their heart, what they're passionate about, and the gifts of their hands, what they do. I love the story. I talked to a woman, I have a friend who lives in Ohio, and she has volunteered with her church for over 25 years to go on mission trips. One year we had breakfast and I asked her, did you go on your mission trip yet? And she said, oh no, I go in 2 months. I think it was 2 months. I said, I've never been on a mission trip. What do you do? And she goes, well, I go to Nicaragua, and she said, I build houses. I said, oh, you're a builder. And she goes, no, I put up walls. I said, you're a builder. She said, no, I put up walls. Okay. I said, what else do you do? She goes, well, sometimes we have machinery and I take the little kids away from the machinery and I might tell them stories. I might tell them stories about Jesus. I said, oh, you're a teacher. She said, no, I tell them stories. I said, oh, okay. What else do you do? She said, Barb, let me show you something. And she gets her smartphone out and swipes, and she shows me a picture. And she said, I made these centerpieces for a pancake breakfast. I had a pancake breakfast fundraiser at my church to raise money for the trip. I said, you're an artist. She said, no, I made the centerpieces and they were beautiful. I said, you're a fundraiser. And she goes, what? And I said, you raised money. And she goes, oh, Barb, you know what else I do? I said, what? She goes, I buy toys. I said, you buy toys? She goes, yeah, the kids don't have toys. So I buy toys. I said, can I ask you a personal question? Does the church give you money? She said, oh, no. My sister helps me develop a budget and I save money all year. And then I go and buy toys and I take them to the kids. I said, so you're a philanthropist? And she goes, what the blank is that? And I said, it's somebody who uses their money to help others. Do you see the difference in the words I used and the words she used? She told me what she does. I put up walls, I tell stories, I made a centerpiece. Oh, okay. Okay. And I used valued roles. You're a builder, you're a teacher, you're a philanthropist, you're an artist. We need to start using words that convey a valued role. So I love the word community. We use it so often, don't we? Community outings, community programs, community living, community employment, as opposed to where. We have made community a program. And we talk about people visiting. Oh, we go out in the community every day. And I just go, oh my gosh, if you made me go out every day, I think I would just die. I don't want to go out every day. And community is not where we visit. You know, we go to Walmart. Oh my gosh, I hate going to Walmart. It's too crowded. It's crazy. Community is where you go and you belong. You go on a regular basis because you go to a group that has common interests. And when you don't show up, they miss you. Community is your third place. Your first place is where you live. Your second place is where you go during the day, school, work, volunteer. Your third place is where you go on a routine basis to be with people with shared focus, or, you know, a book club, an athletic team, your faith-based community, a gym class, and where when you don't show up, you're missed. So think about your own community. Mine happens to be church. I also, yep, me too, yep. My other community is I go to a group every Tuesday night. We have a passion and we meet every Tuesday night. So church, my community kind of also is the why, because when I don't show up, they're like, hey, we haven't seen you, Barb. Oh, geez. Okay, my community is not Walmart. It's not McDonald's. Okay. So where do people belong in their community? Important too, we want to be detailed. We just don't want to say family and friends. So type in chat, maybe one thing that's important to you. Don't say family and friends. What about family and friends? So one woman I asked and she said, my family. I said, well, what about your family? What do you want to do with them that if you don't, you feel like, oh my gosh, I missed that. And she said, I want to have a quiet evening with just mom and dad. Another person told me, I want to go to karaoke with my friends. So it's not just friends, but what about friends? Why do I ask you for details? If we're supporting people and all they tell us is family and friends, I have no idea how to support them to have the life they value. That's so generic. Family dinners. Okay, travel with family. So snuggles with my dog. I love it. I'm so glad you put your pets. Yes, yes. Board games, heart to heart with your bestie, traveling to national parks, going to the gym, church, family, yoga class, gardening, laughing, relationships, relaxing and reading, biking with my daughter. I love how you're thinking. That's the information we want to get from people. What's important to you? Because as I authorize services, I should be making sure that what's important to you happens. And if you need help, we should be authorizing services to help you. Thank you for typing in chat. Oh gosh, you guys are awesome. Watching sports, taking my daughter to Cedar Point. Oh, rolling coasters. Yikes. Okay. Cuddles with your animals, walk with your husband. Awesome. Third section, how to best support me. So what do other people need to do to support you? So here are some things that people have told me. When you teach me something new, tell me, show me, watch me, and then tell me how I did. Not Barbara needs verbal prompts or Barbara needs visual learning. That tells the person that's helping me nothing. But if you're teaching me something new, tell me, show me, watch me, then tell me how I did. Don't tell me what to do. Give me two choices. Follow the behavior support guidelines. Remind me to wear headphones in a noisy place. Don't talk to me like a child. So how to best support me is a to-do list for people who support. It's not a list of deficits. So We're going to put you in breakout rooms. Let me see how many there are of you. 60. Awesome. We'll put you in groups of 5 each if we can, Erica. Will that work? And I just want you to introduce yourself in less than a minute. Everybody gets a turn. We'll give you 7 minutes. I want you to tell people who you are, what county you're from, what your coworkers like about you, just one thing that's important to you at work. And then how can other people support you at work? So for me, when I was working, people liked that I knew I had lots of resources. I had history of what we had done. So people would say, didn't we do this? And I'd be like, yes, we have. And let me send you what we did. So I was passionate. I was helpful. What was important to me at work, having time first thing in the morning to make my to-do list, answer my email and voicemail. What can others do to support me? Be on time for meetings. So I just did that in about 20 seconds. Go into your groups and introduce yourself, and we'll see you in 7 minutes. Thanks, Erica.
All right, guys, I'm going to open the rooms up. Once I open them, you will see an invitation. You see the invitation, please accept, and it will take you to the room. Thank you. Here we go, guys. You should now be seeing an invitation. The ones still with us, if you are having issues or you didn't get an invite, please put in chat or speak up now and I can get you into a room. Aaron, I'm going to move you to room 12. I'm just going to start putting people in breakout rooms. That's not put anything in chat. So you're going to get another invite coming up for the rest of you that's still with me, hearing me talk. Jacqueline, I'm moving you to room 11. Please accept the invite here now, please. Thank you. Kelly, I'm moving you to room 12. Susie, I'm moving you to room 10. Please accept your invite. Fallon, I am moving you to room 12 if you're there. Please accept your invite. Margaret, I'm moving you to room 9. Please accept your invite. Okay, so I have everybody, like I moved all of you guys to a room and you have not accepted. I'm going to have to start taking notes of who's not joining a room. You guys have not said anything if you're having any issues. So I'm going to have to write you down if you're not going to be participating. So yes, please speak now for our forever hold your peace here. Thank you.
And Erica, I'm running the timer. I don't know if you started it because you were so busy moving.
Yeah. Thank you
Uh,
for doing that. I had it ready to go and then I just never pressed start.
I know, you were too busy. So I will let you know when it's a minute so
Oh,
that you can send the notice out to the breakout rooms, right?
yes. Yeah, sorry. I'm just looking at the rooms. I have one by himself because nobody joined with him. Sorry.
Oh, okay. Okay, I
Sorry. Yeah.
didn't go
Uh,
that far. Uh-oh. I just
Oh, I
was,
guess yeah. Sorry. I'm just looking. My bad.
okay. Okay.
Sorry, the robot's by himself. The Rodney robot is by
Oh,
himself now. So
okay.
the poor guy was with the robot.
Ah, okay, well,
All right, as mentioned, for the others still with us here in me and Barb chat, I'm just making screenshots, so just for y'all to know. So if you want those CEUs, I got you screenshotted.
Erica, you can give them a 1-minute warning.
Okay, closing rooms.
Awesome.
Yes.
Welcome back. To those of you I know, hi Kelly, hi Kevin. It's so nice to see your face, Kevin.
Hi, Barb,
Hi.
too.
Okay, so we'll let the rest of the people come back. Okay, I think we are all back. So thank you. Again, if you're expecting CEUs, you've got to participate in the breakouts. Go and participate just like you would if you were in person. You would be at tables and I would be walking around making sure everyone was participating. So thank you for participating. As I said before, we should not be doing anything with people and families unless we do it on ourselves. You know, families are not our guinea pigs. So get some practice using it on yourself before you turn around and ask someone else to share. So whenever you develop a one page, there's got to be a reason. We don't just develop them to develop them. You know, oh, everybody should have one. Yeah, maybe not. What's the purpose? Who's going to read it? And what do they need to know? So for example, if someone has a one page because they're going for a job, that one page description may be different from if they have a one page if they're in the hospital, because what people need to know is different. The reason we focus on keeping this at one page is everyone will read one page. I'm not going to ask you how many pages your plans are, but the last I heard, it was anywhere from 8 to 80. Who's going to sit and read 8 to 80 pages? No one. So this is a one page for my brother. You see there's a photograph. He's in a car. He's in a convertible. Nick loved cars. This is not my car. Let me just make that clear. It was a friend's car, but that was the picture he liked. He liked to be called Nick the Greek, not Nick Seferis. So it says Nick the Greek. Please only use quotes or I if the person said it. Otherwise, we're committing libel. Okay, don't put anything in writing that the person didn't say. So you see under great things about him, the first thing my mother would always say is your brother is ornery. So that's number one. But if Nick were looking for a job, we would not put ornery down because that is not what an employer wants to know, okay? Important too, I tried to cover those 8 categories: people and relationships, culture and identity, things to do, things to have, you know, and, you know, chatting with me every night, our Greek culture, traditions, and religion, listening to his music loudly, going to the bar, having his 7-7 and watching the Indians games. They were called the Indians when Nick was alive. How to best support. We learned these the hard way. So use a spoon to feed me. And he said this, put the food between my teeth. I can hear and understand you. Don't you yell. And don't use a parent voice. I'm old enough to be your father. So you know that parent voice. Hi, Nick, how are you? And he was always a very small man. You know, he never weighed more than 75 pounds. But he would be in his 40s and staff who were 20 would talk to him like a little kid. Don't give me fruit. And I'm most comfortable in my chair. Here are 2 more. I'm not going to read them to you, but on the left is a one page that Maxwell's mother wrote for when she went back to work. And now Maxwell was going to be taken care of by somebody else. And so this is Maxwell. On the right is, as Maxwell got older, he's a toddler, things changed. And now she broke down how to support me with sleep, how to support me with eating, and other ways to support me. And she included a section, what's important to mom and dad. This one is developed for Liam, and it's only for medical appointments. So it's, you know, he's visually impaired, hearing impaired. Let him feel the stethoscope before you put it on his chest. Let him put it in his ears. Let him touch things, feel things, so he knows what's going on. This is Tyler's. I love Tyler's because if you met Tyler, how would you start a conversation? All you have to do is talk about dinosaurs. One dad has, when his son was 3 years old, he was diagnosed on the spectrum, and they were getting ready to go to a family reunion in a couple of months. And he and his wife knew that the word had gotten out that their son had autism, and they didn't want anybody to be afraid of him. They wanted the family to engage. And so they put pictures of Barney and pictures of Thomas the engine or whatever it's called, and put things like how to support me. When I kick the ball to you, it means I want to play soccer with me. And so the family, and they put all these icons on it so that the family felt comfortable. All these people who had never met his son would know how to engage with his son. This is Elizabeth Cates. People told her, your font is too difficult to read. And she said, too bad, it's my one page. I want it this way. I thought, boy, talk about self-determination. This is for Sophia. I believe she had a stroke and was in rehab. And she said, what's important to her is not having scary hospital hair. So make sure it's untangled and unmatted. Help me do that. Make sure she has certain things in front of her so she can reach them easily. So you see, there are a variety of one pages for a variety of purposes. This is Ruth's. I love this. Ruth lived with her granddaughter and grandson-in-law, but look under what's important too. Having a little pour before bed, which is rum and tea. That's important to her. You got to make sure she has it. We have learned that it is also very important for people who typically go to the hospital or unexpectedly that they have a one page. And it's written specifically for hospitalization. Again, have a photo. I tell families and providers, sometimes providers will develop a one page for hospitalization and they will staple it to the back of the emergency medical form so that if someone has to go to be transported, they will get that emergency medical form with the medications, the diagnosis, everything. And then they'll get the one page of how to interact with the person. I tell people, put it in a plastic sheet protector and put it above the bed. Important too in the hospital is going to be different. You know, that they have their cell phone, that you tell them what's happening, that they introduce themselves. I don't know if any of you have sat with family in the hospital. People come in all the time and they don't tell you who they are. And you're like, excuse me, who are you? Tell me who you are before you start. Maybe to have the chaplain visit, maybe to have their comfort items, or maybe leave the TV on because they can't handle the remote. How to best support, you know, what they need to do, how to position them, how they might show pain, who to contact if they want to talk over a decision. So now for my brother for the hospital, it's a little different. The great things about him are the same, but what's important is chatting with me and talking over decisions with me and putting my phone number. Now, if Nick was in the hospital, I went every day, but I had to work. So I wasn't there all day. I might have flexed part of the day, but if there are any decisions to make, have him call me because Nick was his own guardian. I did not become his guardian because I knew he could make informed decisions when he talked to me. Tell me who you are and what you're doing. And I want to see the priest. Again, how to feed him. Nick used a laptop with voice output, but he couldn't use it if he was in bed or if he was in the hospital. So ask me no, yes, no questions. I can understand and I can nod or I'll move my eyebrows. Now, Not everybody can answer yes, no questions reliably, but remember, his sister was a licensed speech pathologist. He knew how to answer yes, no questions, how to put him in bed, how to put that call button, how to give him his pills, and leave the TV on because he couldn't use the remote. Here are some other one-page descriptions for hospitalization. For Sam, how to support him: distract him with conversation about feeding birds or growing plants when you're doing any therapies. Use chocolate pudding or chocolate ice cream to give him pills, and what's calling his daughters who are in the photo to talk over things. For Martin, make sure his phone is charged and accessible. Help him call mom. If he's upset, ask him if he wants to talk to Mario. Ask, don't order. Make sure his walker is in reach, and no lectures. That's what we all want, right? Don't lecture me about what I should be doing or that I should be eating better or not smoking. Don't lecture me. For Jim, he wrote his own. So I am a kind and gentle person. What's important to me? Talking to Holly every day. There's the phone number. Having Ted help me make decisions. There's the phone number. Having a large pop close by always. I'm a smoker. I may need a nicotine patch. I recently had my teeth pulled. I may need soft foods. And if I get down in the dumps, remind me of all the great things I did down here at the bottom. So you see lots of lots of examples. Our project manager, Tracy, her daughter is a nurse, and she called her mother one day and said, there's somebody who just came up from emergency. She's 40 years old. She has autism. Now you need to know that Tara's twin, Trey, has autism. And she said she knocked teeth out. The caregiver is here. The provider is here. Family is driving. They're 2 hours away. She came up from ER, no pain meds. She's been given a large dose of ketamine. She's in a confining bed. She's not cleaned up, and she has no clothing on. She said, Mom, she called her mom and said, you have something. You have something. Help me. Her mother explained the one page. Tara went and talked to the caregiver. She said, she sat with the caregiver and the person, addressed the person, even though the person was nonverbal, and said, what do people like about her? What do we need to know? Why wasn't she given pain meds? Well, she couldn't answer that infamous question. What's your pain level? 0 to 10. Tara developed the one page. She said, why is she in a confining bed? Well, if she's in a bed, she knows she's in the hospital and she'll fight to get out of bed. Well, where does she sleep at home? In a recliner. We can get a recliner. Anyway, she wrote this all up, put it above the bed. The nursing staff came in and they were reading it and going, oh, we know exactly how to help her. The patient got better care. That provider, the caregiver, was able to step out for a couple minutes, knowing that the nurses knew what to do. The next day, the doctors went on rounds, and the doctor said, what is that thing above her bed? That is so cool. Why doesn't everybody have that? I can read the file and know medically what she needs, but I don't know who the patient is. I don't know anything about the patient. And he said, why can't we have this for everybody? Well, because somebody's got to write it. But what happened was the caregiver, the provider, contacted Tara a little bit later and said, is there a form that we could use? Because we want to do this for everybody that lives in this house, so that if they go to the hospital, it's written up and people will know what to do. So if you are a provider, if you are an SSA that works with someone who does have frequent hospitalizations, think about writing one for hospitalization. The one page is good for introductions. It's a good quick summary. When I've worked with self-advocates and had them help them develop their one page, what I hear over and over and over is, I never realized that about myself. I never knew people saw that in me. And if you are working with teenagers in that transition, 14 to 22, part of their IEP process is that they identify accommodations, how to best support me. So teaching the students how to identify the supports they need is empowering them to identify their accommodations. So think about developing a one page anytime there's a change in someone's life, any transition. Right now, writing it for camp, if someone's going to camp, if someone has difficulty at healthcare appointments, if they're going to a new program, a new classroom in the fall. Some providers, day and residential, have written one pages with photographs for everybody in their group or in their residential setting. And that's the subfolder. So when someone comes in, they can flip through it and see how they need to support people. It's also good for onboarding new staff. You know, when new staff are hired, here's who you're going to be working with. I already told you about extended family. For an employer, and staff and teams have done it. So I'm working with Seneca County SSAs right now, and one of their staff who does not work directly, she's an SSA supervisor, does not work directly with people or families, did a one page for the SSA department. And as they hire people, they're going to give them that one page so that they get to know a little bit about the SSA department. I thought that is so cool. What a great way. So the one page, the vision we have is that it is human-centric, that it talks about who is this human being, this person that people love. What are their qualities? What do others need to do to support them? So it's very respectful. It's not what they can't do. It's what we need to do to support them so that they are respected and feel comfortable. It's developed for a purpose because the information will change. We use a photo because it shows who the person is. And I have worked with lots of people, and very few people will say, I don't want to put my picture on it. Very few. And you let them pick their own picture. And it's developed by the person, the family, or the people who know them the best. So an SSA, you may say to people, you know, you're going to be interviewing a new provider. Let's develop a one page to show who you are. And you may work with the person and the family. And then you may say, take it, look at it, and add anything you want. We'll change it. And then you can use it when you interview people. Here's a little bit about who I am. It's not demographic information. You saw nothing that said their disability. It's not a list of services. So a poll, I'm sorry, Erica, I should have given you more lead time. I apologize.
All good. I will launch it now for you. Just give me 1
Okay.
second.
And you should be able to choose as many as you want. So there it is. How can a one page help? Awesome. And really, it's all of the above. So thank you. So one last thing I want you to think about is, do you have anyone in particular in mind? that you're thinking, I should really work with them to help them develop a one page. And if you do, can you type it in chat? Any specifics, like, oh my gosh, I did this with a group and they were like, one SSA said this person is getting a payee. And so we developed a one page, everyone in the agency. Okay, your son, good, 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 good. Love it, love it. Yeah. Looking to start working, yes. So when he goes for an interview, this could be part of his resume. He could hand it over and say, here's a little bit about me. Starting his first job at Mark's. Yes, absolutely. Yes, going to high school. Yes, my aging mother. Absolutely, Hannah. Absolutely. Anybody who's coming in to work with her. Thank you, Kimberly. Share it with your district. If there's anything we could do, please reach out to us. Yes, adult day services. Yes. Oh, new family on my caseload. Awesome. Me first. I love it. Yeah, someone with chronic seizures. Yes. Find a provider. Oh, the hospital staff couldn't understand them. Yes. Oh, awesome ideas, everybody. Thank you for sharing. This is actually a good time to take a break. So why don't we take a 7-minute break, and I will see you in 7 minutes. Thank you, everybody. I sent.
Of course.
So now let's talk. I keep using the phrase, I keep using the phrase good life, but what's a good life? So let me define it. And this is how we should define it with people, not just, hi, what's your good life? But a good life is that you have dreams. And I once heard someone say, and I don't remember who, I wish I did, that without dreams, we don't have a life. All we get is what we're given. And think about that. You know, if we can say to a team, I want to be able to have a job I like, or I want to live in my own apartment, then the team's job is, so what do we need to do to help you get there? As opposed to, we can give you this, we can give you this, we can give you this. We've got to come in with a vision and share our dreams. A good life is that we have people who believe in us. Think about that job coach with the gentleman who wanted to be a pilot. Okay, let's see if we can find something at an airport. A good life is that we have what's important to us. Not our likes and preferences, but what's important to us. Remember, important too are things that help us feel content, happy, and satisfied in our life. And if they were missing, we would not have a good life. A good life is that we're respected and valued as a member of our community, whatever your community is. And we have more good days than bad, because none of us live in utopia. That we feel healthy and safe, and that we have control. So if I think about my brother Nick, did he have dreams? Yes. You see, he wanted to drive. And so you see a picture of him when he turned 16. He wanted to drive. He told Jim and I he wanted to drive. And we put him in our Volkswagen Beetle and took pictures, because when we were 16, you had to take pictures to the drugstore and have them developed. You see, he's wearing a cool jacket. He's got sunglasses on. His hand is on the steering wheel. There's keys in the ignition. We tried to get his right hand, which had lots of contractures, on the gear. He couldn't, it wouldn't stay there. We took pictures. We showed them to my mother. And she went ballistic on me. What's the matter with you? You're the oldest. How did you let him drive, Mom? He's in the car. You let him drive. How could he drive? He can't drive. Mom, the car never moved. But look at my brother's expression. So we need to make sure we understand what people mean, not what we think. He did not want to drive the car on the road. The car is in the backyard. It never moved, okay? On the bottom right, he wanted to go to Disney. He did not want to go with anybody else with a disability. That is a picture of him. My mother, I think Jim is in that picture. Let me move. Yeah. My mother, Jim, Nick, and I, and the 2 caregivers that were paid to take him. Did he have what was important to him? I think so. Was he respected and valued? Yes, and when he wasn't, he spoke up. He was called for jury duty once, and some attorney said, we can't let that retard on the jury because he drools, and the judge reamed out the attorney, and Nick typed a nice letter to that judge. But anyway, does he have more good days than bad? Does he feel healthy and safe? And did he have control over decisions affecting his life? I am a strong believer in informed decision-making, and I believe Nick had control over decisions, not only affecting his life, but also the end of his life. So here's Chris Nickich. I don't know how many of you have ever heard of him. He is the first person with Down syndrome to compete in and complete the Ironman competition. He competed in Florida. Just in case you don't know what Ironman is, it's listed. It's pretty overwhelming. But what I love is I saw an ESPN sports special about Chris, and look at the far left. He lived at the time, I don't know what he's doing now. He lived with his parents. He had a huge whiteboard. I mean, it looked like it took up a wall in a room. And every month he had a calendar, and every day he wrote what he had to do to train for the Ironman and what he could eat and what he could not eat. So I laughed because he would have, every so often there would be a pizza day, but he couldn't eat pizza other days. But look at his dreams. His parents had him write his dreams down. He wants to buy his own car, buy his own house, get a smoking hot blonde wife from Minnesota. I told you he was from Florida, so I don't know why he thinks the smoking hot blonde wife comes from Minnesota. Don't know. Want to have my own money, take care of my family, and be a famous public speaker. So it's important for people to have a vision. This is a trajectory. You see the arrow going up to what I want, the arrow going towards what I don't want. These are themes, okay? And when we have conversations and people say, I want to have friends, we need to ask, what does that mean to you? What does it look like? And people would then tell me, I like to go out with my girlfriends once a month for dinner. Oh, okay, let's write that down. I want to have a job I like. Well, what do you like? So we get more details so we can truly help them. And we have a good way to judge quality assurance. Are we helping people move towards the life they want? Please remember that we should never be defined by our past. It was just a lesson and not a life sentence. So I'm not going to ask you how many of you have overcharged your credit cards. I'm not going to ask you how many of you have ever been in a relationship that was not good for you, not healthy. And how would you feel if every time someone introduced you, they would say, here's Bob. Bob overcharged his credit cards. He charged $10,000. It took him 5 years to pay it off. How would you like it if people introduced you by your mistakes? And yet, what do we do with people that receive services? If they've done anything in their past, we say they can't do it. Oh God, they're at risk. And instead of looking at how to mitigate the risk, we limit people's rights. This is an exploring trajectory. It just asks 2 questions. What do you want? What don't you want? I like using this when I first meet people so I could build some trust. Tell me what you want. Just as important as asking people what they don't want. Number one answer from people with lived experience, what they don't want is drama. And I have to ask them, what does drama mean? Well, it means people who are loud, people who are negative, people who boss me around, people who are noisy. Number one from families, what I don't want, and it may be easier for them to identify what they don't want than what they do want, is having my loved one be taken advantage of financially, sexually, emotionally, physically. So, and people may not have I know the OISP asks for every domain for an outcome. And quite frankly, people may not have an outcome in every domain. So think about what is your good life. Think about your dreams. And if you're comfortable, type in chat. What's a good life for you? A lot of you identified, I think, what a good life for you is when you identified what is important to you. You know, dinner with family, going on vacations, taking walks with your partner or your spouse. And just as important to raise a healthy and happy family, being content with what we have. Nice. Sunshine, having peace. When I get what I want, yes. Now think about to do my job and not get burned out. Oh my gosh. Life balance. Good luck with that, Montserrat. We all try for that. It's so hard. Second son getting married. Oh, nice, nice. Love it, love it. But now think about what you want to avoid. And it's not always the flip of what you want. So just take a minute. What do you want to avoid? Negativity, yeah. Lots of us put negativity, drama, you know, let people on your caseload down, feeling unhealthy. Yes, 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 yes. Too much stress. Stress comes up a lot for staff. Isn't that sad? Negativity, stress. Thank you, everybody. Appreciate it. So think about that. We want to learn from people, but you know what? Too often we've taught people that that they should tell us they want to be independent. And I don't know what that word means. So here's a quote from Judy Heumann, who is a disability rights advocate. She passed away last fall. Judy Heumann lived with spina bifida. Judy wanted to be a teacher. She was told in college that she couldn't be a teacher because a teacher couldn't use a wheelchair. Think about how stupid that thinking is. But she defined independent living is not doing things by yourself. It is being in control of how things are done. And I wish we used that definition instead of telling people they have to be independent and do everything themselves, and telling families that. I had a father tell me my daughter will never be able to live in her own apartment because she doesn't know how to cook and she can't do laundry. And he goes, we're trying. And she'll never be able to live in her own until she can do that. And I looked at him and I said, does your daughter have a waiver? And he said, yes. And I said, a waiver is to provide the support someone needs on a day-to-day basis. I said, that's what you have a waiver for. So why are we telling people they have to be independent? This is a planning trajectory. So not only do we look at what do people want, what do they want to avoid, but now remember, we talk about one of the principles in charting the life course is the importance of having experiences. So what if people tried in the past that has worked? Up here on top, what did they try that didn't work? Yikes. And then moving forward, what do we need to do to move towards your vision? And what do we need to avoid so it doesn't take you down towards what you don't want? I have seen some families fill out the what they want, what they don't want, what they've tried in the past, what hasn't, what worked and what didn't work, and then taken it to their team, IEP, ISP, and said, how can you help us move forward? So I know the pandemic we hope is over, but I have a friend in California who just got a case of COVID. And next question. There we go. Thanks, Erica. And so she is missing a vacation right now. She posted on Facebook, canceled my vacation and put the COVID test on Facebook. So we are not quite out of it. But it is one experience that we all had. It affected our good life immediately. Immediately. One day we went to work. The next day we were told you no longer come to work. We were told, do not go out in public. We were told, stay away. We were told, we saw schools close, churches close, all sorts of places close. So what did you miss? And you could pick as many as you want. Things to do and places to go, and people and relationships. Absolutely. And then all of a sudden we lost our purpose and meaning. What am I going to do? How am I going to do my job in a way that's meaningful? Thank you very much. I like asking you that because, again, it's a universal experience. It changed our life immediately. So if I think about my trajectory, my good life changed from going on vacation that summer, doing 16 in-person presentations from March 10th to June 30th, which did not happen, to staying healthy, not bringing COVID into my house because I was a full-time unpaid family caregiver. What past experiences helped me? Well, I had lots of toilet paper. For those of you who remember the toilet paper shortage, I had Clorox wipes because I buy them anyway. I did not have masks. And so the first time I had to go out, I took a bandana and tied it around my nose and mouth and thought I would be safe. Ha ha. My past experiences, I had worked from home, so that did not scare me. I was comfortable doing that, but I had never set up a Zoom. I joined Zoom, but never set up a Zoom. And all of a sudden I'm like, what do you mean I have to set up a Zoom? So just take a few minutes and think about how your life changed immediately. And I see people put stuff in chat. Anything? Oh, okay, great. So the trajectory really helps people think about, what is my good life? What do I want? You should never do a trajectory in a team meeting, not IEP, not ISP. That's a conversation you have with people outside of a meeting, because how many of us want to share our dreams in a room full of people? We want to think about it. We want to talk about it. You need to also provide some guidance to people, and I'll get into that in a minute. Please know that the person can do a trajectory, the family can do a trajectory. It doesn't have to be the same, because how many of us live with people who have the same vision we do? Why do we expect families to be in consensus all the time? None of us have consensus in our families. Of course, you need to review it, and it can be broad. It could be for a whole year. It could be, let's just do a trajectory for employment because that's what you want. You want a job. Or it could be very short term. Let's do a trajectory, how we're going to get through the summer. What's a good summer for our family, especially with kids home from school? Here's a group of people with lived experience who developed their trajectory. it's like a vision board. They cut pictures out of a magazine, they wrote, they drew. It doesn't matter. Here's a group of people. This group was a Project STIR training in Stark County. And we asked people at the end of the Project STIR training, share one outcome that you want, one that you don't want. People came up to me with more than one Post-it note per person. I thought I could theme them. I couldn't keep up with them. They were just handing me Post-it notes. But what was exciting is the superintendent or the executive director of Stark County Board came so we could all thank him because he sponsored the training. And I said, you need to go look at the trajectory for people you support. And he came back and he goes, oh my gosh, this is overwhelming. People did not write, I want to be independent. Okay, they wrote, I want a job working with computers. I want a girlfriend. I want to move into my own place. One gentleman wrote, under what I want to avoid, I don't want to die alone. Very powerful when people are given the opportunity to truly share. The next month in his newsletter, he included some of the Post-its and said, this is what people we support want. And I thought, how powerful. He gave voice to people. A lot of times people will look at me, what do you mean, what do I want? And I have to go through the domains. There are 6 life domains. They're all interrelated. And these are really quality of life areas. When we talk about having a good quality of life, we talk about what we do during the day, where we live, who we spend time with, how we take care of our spiritual self, whether it's yoga, journaling, going to church, going to temple, meditating, healthy living. Notice it doesn't say health and safety. It says healthy living. How do we take care of our physical and mental self? Safety and security. We talk about fire drills. People who go to school, people who go to day programs, it's mandatory that we do drills once a month. So you think people know what to do. I was working in Licking County. I did a side-by-side training with staff from 3-day programs, and they came with a group of 4 people they supported. And I said, what do you need to know in Licking County for safety? I live in the snow belt, so I need to know, safety means I have a car, I feel safe driving in the snow. I know what to do if there's a blizzard. We don't have tornadoes. We have strong winds, but I've not been part of a tornado. We've had earthquakes. We don't have floods. And people in Licking County go, we have floods. I'm like, oh, do you know what to do in case of a flood? And people were giving me answers. I said, do you know what to do in case of a fire in your house? Because I've been in a house fire. And one of the women said, yes, I do. I said, what do you do? She goes, I go in and get my cat. We've taught people, evacuate, get out. She knew to do it in school. She knows to do it at the day program, but in her house, she's going to go run around and look for the cat. And I can't tell you how many of us jumped forward and said, no, get out. One of the staff was a volunteer fireman. And she just went, no, get out of the house. Don't go in for the cat. Oh my God. So we think we've taught people, and they haven't generalized to another setting. And then advocacy, speaking up for ourselves. Think about this. Where you live may impact where you work, or the other way around. Where you work may impact where you live. Where you work may impact your healthy living because you may be eligible for different medical insurance, and you may have to change your providers because you've changed jobs. So all of these are interrelated, but they're quality of life areas. When I work with families, when I work with people with lived experience, I spend time talking about each domain and having them think about, well, what do they want? This is a vision tool, and it lists the 6 domains Plus at the bottom, it says, well, what supports might help your family and what are some integrated support options? So here are the 6 domains. You see the first column is the icon. The second column are words, the name of the domain, and a quick description. The third column has white space. So I had people do this. Their staff, some of their staff scribed for them. Some of the people wrote their own, and a couple of people drew in this white space. I will be honest, I could not tell what they drew, but you asked the question, tell me what your vision is. What did you put in this box? The last column is priority, and I don't push for that. I'm like, tell me, and also when we work with people, telling them that it's not just what's your vision of if you want something different, but also it's your vision if you want something that's happening right now to continue. I don't want people to be stressed like I got to change my life. Right now, I live in a condo. I intentionally bought a condo before I retired and sold my house. Why? I wanted my life to be a little easier. I also wanted a full bath on the first floor and the second floor, and that's what my condo has. So thinking about if ever I can't use steps, I could stay downstairs and have a full bath. So I'm not going to move. My vision is I stay here. So don't always push. What do you want to be different? It could be what do you want to be the same or change? When you ask people about their vision, it helps everyone be heard. Like I said, the family can give their vision, the person can give their vision. But it also helps you identify common areas. The family agrees, they have a common vision, that's what we can work on. If it's separate, if it's different, then it leads to conversation about why is it different? What can we do? How can we work together? What do we need to clarify? We sent you this experiences and questions booklet. I hope you save it. It is located on lifecoursetools.com. Go to library and then go to exploring life stages. I'll show you a 2-page spread, but it will talk about questions for each domain across the lifespan. Why is this a good resource for you? Because many of you are working with people in several life stages. We need to help people look to the next life stage, anticipatory guidance. So some of you may not be, okay, let me go back. My anticipatory guidance was as I was nearing retirement, I thought, I don't want this house anymore. I want life to be a little easier. That was my anticipatory guidance. I want to move. A lot of you are working. Perhaps you are also already looking at retirement. It may be 2 years away, it may be 5, it may be 10, it may be 20. But you may be looking at, what do I need to do to get ready for retirement? Will my retirement pay my expenses? Do I need to pay off my house? Do I need to save more money? Do I need to open an IRA? And so you are anticipating. But you also need to look at the previous stage. Did you miss anything? Were there experiences and opportunities you should have considered and didn't have? So here's a 2-page spread. Oh, thanks, Erica. You see, this is daily life and employment. And a lot of parents of young kids go, why are you talking about daily life and employment? But there's questions for you to use to have conversations. So in early childhood, are you sending me to daycare or preschool? Why is that important? To be around other people, to learn a routine. Are you giving me opportunities to make choices between two items? That's important for employment and daily life. Why? Because we're teaching people decision-making. We're teaching people consequences. I chose the grape Kool-Aid. I don't really like it. Oh, well, that's what you chose. Next time, choose the cherry or the red or whatever. You know, choosing what top to wear. And so it gives you conversation starters for every life stage. A resource that I would love to see us sharing with people and families. I was just I observed a Project STIR training done with high school students with and without disabilities. And when we got to the part where we talked about what do you want to, you're all in transition. You're going to be graduating from school in 3 to 4 years. I think the youngest person was a freshman. What are you going to do after? And we gave them this 4-pager, Transition to Adulthood. These are called quick guides. They're 4-pagers. They are on lifecoursetools.com under library, under exploring life stages. There's one for each of 5 life stages. There's not one for prenatal. It starts with early childhood, school age, transition, adult, and aging. And let me take you through the 4-pager. Again, think about downloading this. They're free. Print them or email the electronic version to families, to people receiving supports. Tell them to look it over. We're going to be talking about these domains in your planning meeting. These are things to think about. So on the front page, it just lists the life stage, adulthood. What does adulthood mean? It's the time from when you leave school to entering your golden years. On page 2, 3 of the life domains are defined. You see the icon, the words, the definition, and then some guiding questions. What is something you want to learn more about? What are your skills or interests? Do you want to continue learning at your job, volunteering in the community with friends? What are things you like to do? What kind of job would you like? What kind of volunteer opportunities might you like? What technology can help you? So 3 of the 6 domains, page 3, the other 3 domains, so people can think about it and have time to think about it. And you're not just sitting there going, so what do you want? What do you want? What do you want? And then on page 4, thinking about, well, what can help me? Where can I get services? And also, what help might the family need? So the trajectory, what we want to see is that our vision for the trajectory is the person and the family can think about what is their vision of a good life. Staff can start the conversation and write on the trajectory what the person tells you. And the family can fill out a trajectory, the person can fill out a trajectory. It's not, what we don't want is it should never be done in a team meeting. And it's not done by the team. It is not our job, none of our jobs, to identify a good life for somebody. Our job is to identify what helps them get to their good life. So I was working, a woman attended a training I did, on charting the life course. And she said, would you meet with my son? He's 24 or 5. He had just moved into his own apartment and he won't talk to me about, now that you're in your own apartment, what do you want to do? And she goes, we're thrilled that he's in his own apartment. I said, I'm happy to meet with him if he wants to meet with me. And she goes, okay, let me talk to him. She said, can you meet with him in person? I said, where does he live? He actually lives maybe a half an hour from me. I said, yes, I can do that. And she said, where could you meet him? And I said, wherever he's comfortable. So I can go to his apartment if he wants to. It was summer. So I said, we can meet outside somewhere, wherever he feels comfortable talking. So she calls me back and she said, he's willing to meet with you. He wants to meet you at his apartment. He wants his dad and I to be there when you get there because he doesn't know you. I said, absolutely. So I go, we set up a time, I go. I took the portfolio with me. So the one page, the trajectory, and the integrated support star, which we're going to talk about. Mom and dad had done a trajectory. They had shared it with me. This is what we want for our son. But he won't talk to us. So I sat there, I sat in his apartment. I just had a conversation with him. I saw he had posters up. I asked him what they were of and what movies, because I did not know what the movies were. But as he talked about the movies, he started sharing stuff he liked and that he wanted to do and blah, 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 blah. And all I did, I said, I take notes when I meet people, so I remember what they said. I'm going to take notes on this paper, but I'm going to give it to you. I'm not going to take it with me. And I would just flip through the portfolio and write stuff as he was talking. As about 45 minutes into our conversation, 40 minutes, he was getting tired. I said, I see you're tired. We've talked for 40 minutes. Let me just read back to you what I wrote down. Tell me if I got it right. I went through the one page, the trajectory, the integrated support star, and said, did I get it right? Do you want me to change anything? Blah, blah, blah. Went through that and said, this is your paper. I'm going to tell you that mom and dad shared what they want for you, what they would like to see you do. And it's very similar to what you shared with me. I said, you need to share this with mom and dad so they can help you and you guys can work together. I said, would you like me to show it to them? Oh, and they said, when you're done, text us. And they went outside. It was a beautiful day. They were sitting outside and we'll come back up. I texted them and I said, do you want me to share it with them? Nope. Nope. I said, okay, this is what I'm going to tell your parents. I talked to you, I wrote down, I gave it to you. And I said, I'm going to tell them that you didn't want me to share with them and that it's up to the three of you to figure that out. He said, okay. So again, people can have separate, it's fine. Poll number 7. Sorry, Erica, I should be giving you heads up. And
Oh, you're fine. I'm just trying to wiggle my mouse to get it started up. My screen's
Okay.
going on here. You are totally fine.
Okay.
Oh, hold on. I got to end poll 6. Give me a sec. I
Okay.
got too ahead of myself. All right, it's launched.
Thank you.
Uh-huh.
So again, you can pick all that you want. So tell me about a trajectory. What do you think? Awesome. You guys are awesome. Keep going. Okay. It is all of them, everybody. Thank you so much. Thank you. So, oh, that's okay, Hannah. Don't worry about it. But it's all of them. A trajectory is not developed by the team. It helps the person and the family identify their good life and what they want to avoid. It helps organize information about what have we done in the past, what worked, what do we need to do in the future, and it helps guide planning. The last tool on the portfolio is something called an integrated support star. So after you figure out an outcome, you put it in the middle, in the white space. So it could be finding a job, hiring a new provider, volunteering, going on a trip, whatever people tell you is their outcome. And then it's a star, so it has 5 points, 5 fingers, and it helps you brainstorm, well, what services and supports can help somebody move towards that outcome. I always tell people to start with personal strengths and assets because we want this to be strengths-based, and end with eligibility. So if we think about, let's take something easy. I want a job. Personal strengths and assets may be the person has had experience. They volunteered with animals. They babysat. They had an experience working in a restaurant. They're punctual. They're eager to learn. They know how to ride public transportation, or they might have a driver's license, and the family has a car they can use, personal strengths and assets. Maybe they know how to use the public transportation system or the specialized transportation, or maybe they know how to use Uber or Lyft. Relationship-based, who can help you that is not paid? So it's typically friends, family, neighbors, people who know people. So if you want a job and you want to work with animals, let's say, do you know anybody who works with animals? Do you know anybody who works at the shelter or at a pound, or where you can go and ask about a job? Technology. What technology can help you at work? Maybe you learn by watching videos. So maybe watching YouTube videos to see what's it like to work with animals. What does it mean? Maybe you use reminders on your smartphone or tablet. Maybe you can use the app for transportation. Maybe you know how to use the Uber or Lyft app. So it's not just iPad, tablet, smartphone, but what's specific? Maybe you use something, they use something like Siri or Alexa. Oh, shoot, my phone wants to talk to me because I said Siri. Okay. Community-based. What resources are in the community? Are there job boards at their church or at the grocery store? Is there a community listing of available jobs? Can they use technology and look online for jobs? And then eligibility specific would be things like Ohioans, opportunities for Ohioans with disability, OOD. It might be the county board. It might be a provider agency that provides job coaching or that type of thing. So it helps you look at possibilities and not just start with what are you eligible for, but what else can help you. I know on the plan, you've got to identify natural supports. Please let me tell you that families hate this term, natural supports, because it means when families hear natural supports, they think you're not going to help me. You expect me to do this. So I just include some information from Disability Rights Ohio. Natural supports are help that you get from friends, family, or the community for free. It can be personal care, transportation, going to recreation activities, laundry, meal prep, grocery shopping. It could also be banking if your local bank offers assistance with writing checks or paying bills. The Medicaid agency, which is typically the county board because they're the local Medicaid administrative authority, assumes that if people have family or if they live with somebody, they're going to provide the natural supports. But federal law says that natural supports have to be provided to someone voluntarily. So we can't say to the family, so you need to provide natural supports. In other words, no one should be forced to provide natural supports, and the person receiving the support has a choice about whether they want to receive natural support from a particular person. So it's more than just saying, well, the family, you'll do that, you'll do that, you'll do that. This is a split star, and it helps you. Does Medicaid regs define natural support? I would have to look, and I am not sure, which is why I pulled the definition from Disability Rights Ohio. So I am not sure. Whoever posted that, Darlene, did you write it?
Yes, yes. That CFR, I was wondering if that the Code of Federal Regs, is that, I know that
No.
it is in the Rehabilitation Act amendments, probably around 2000. But I was wondering, I don't know about CMS and Medicaid, if it is defined within the Medicaid regs.
I don't
That's
know.
all.
I don't know. That is a good question.
Okay. Thank you.
Thank you. Now I'm like, oh my God, I better look it up.
No, because I think that changes in some ways affects the conversation. But for me, it's like, just making sure the implementation is systematic. But yeah, thank you.
But I know that if the feds, if it's in federal reg, that Medicaid cannot be more restrictive, just like Ohio rules cannot be more restrictive. So if that's what it says, we can't turn around and say, no, it doesn't have to be voluntary.
No, well, I was just getting at the standpoint because the Rehabilitation Act amendments does specify, you can use natural supports as long-term supports for the rehab program, which is really short-term. But Medicaid is totally different. So Medicaid regs could be more restrictive. But I understand parents' angst around hearing that terminology. So my question fell more with Medicaid, and I know that's different from state to state, so it's a bit challenging, but I'll figure that out. But I really appreciate you doing this. Thanks.
Oh, thank you for asking. I appreciate you. It's challenging my thinking now.
I didn't mean to do that. Sorry.
Oh, it's good. It's all good. So the split star, I was like, where was I? Split star helps us identify what supports are currently in place and what supports do we need to look at. So for getting a job, maybe it is currently they don't use public transportation, and the future, they got to learn how to use public transportation or learn how to use some of the apps that might help them, or reach out to somebody under relationships, maybe reach out to somebody who might be able to help them, who might know about that type of work, or who might have opportunities that the person can use. So it helps you identify current, but also what do we need to do in the future? What other kind of resources or supports should we look to? We know that the visualization on the left, what we want to see is that the person is supported in the context of their family, in their community, with 100% integrated supports. So not just green, which is eligibility, but are we looking at strengths, personal strengths and assets that the person or the family has? Are we looking at technology? You know, I love technology. I wish we really looked at it more, because technology can support people to feel more in control because they don't have a human being bossing them around and nagging them. And I use those words because think about how we use technology. We use apps. We might have calendar. We might have reminders set on our calendar. And that means that someone is not in our face saying, don't forget, Barb, in 10 minutes, you have another Zoom call. Okay, which I would see as nagging, but when it pops up on my phone, I can say, yeah, I know. And I don't have anybody nagging me, it's technology. Okay, it removes that emotional response to a person, and it makes me feel more independent. Think about any technology. Too often we think about, tablet, laptop. A mother told me her son told her he wanted to play lacrosse. She looked at him and said, do you even know what lacrosse is? And I guess he had heard somebody talk about lacrosse. And so she said, you know what? Let's go on YouTube. Let's watch some YouTube videos. And let's see what lacrosse is. And then tell me if you want to learn to play lacrosse. How many of you go to YouTube to learn how to fix something around your house? Or, yeah, I know. I once locked my luggage and I forgot the combination. And I had no clue how to reset it. And I went on YouTube after I tried all these possible number combinations. So, using YouTube to teach people, using YouTube. Yes, YouTube knows everything. Yes. So why aren't we saying to people, really, you want to work with animals? What do you want to do? Let's go look on YouTube what that means. Let's look at YouTube of people doing something. You want to cook? You want to learn how to make your favorite food? Let's see if it's on YouTube. Looking at relationships, again, not only people that you know, but people who may know people. So my brother, I told you before, he wanted to go to Disney. He told his team, I want to go to Disney. I was in the team meeting. He never told me. I was like, what? You want to go to Disney? Yeah. We were not a Disney family. We had never gone on vacation. We had never gone to Disney. And so his team immediately said, there's organizations that take people with disabilities on vacation. And Nick said, I don't want to go with anybody else. And they go, but you're going to need help. And he goes, I know. And the team turned to me and said, hey, Barb, maybe you could take them to Disney. And I said, hey, team, that's not a vacation for me. No, let's figure something else out. So when we looked at it, personal strengths and assets, what were Nick's personal strengths? He knew he had to save money. He saved money. He knew he would have to plan. We as a family supported him. At one point, he thought he was going to go to Disney. His team said he doesn't have enough money. He still needs to save more money. And I said, what does he need? How can we help him as a family? Relationships. Once Nick told people he wanted to go to Disney, My cousins, who typically bought him Christmas and birthday presents, said, what does he need? Does he need a suitcase? Does he need clothes? What does he need for his trip? Friends were like, oh, he wants to go to Disney. We're going this year. What does he want to know? We'll talk to him after we come back. People can't help you if they don't know your goal. Technology. Nick had his own laptop. He knew how to search. He knew how to look up stuff. Staff also helped him with planning, figuring out cost and how much he had to have, and figuring out flights and, all that kind of good stuff. Community resources. He could go to the library and get resources. He could have also gone to a travel agent. And then eligibility specific supports. Oh, technology. Let me go back to technology. Nick used a power chair that cost more than my car. Nick used a CPAP machine. Nick used a laptop. All of a sudden, we're like, whoa, what technology do you want to take on your trip? We talked to his team. Does he need to take the CPAP? You know what? He probably could get away 3-4 nights not having the CPAP. Okay, good. What about your laptop, Nick? Do you want to take your laptop? He was afraid. No. And the caregivers that were that he paid to go with him could communicate effectively with him without the laptop. So we were like, okay, the power chair. Well, he needed the power chair. So we got to eligibility specific. Physical therapist said, that power chair is going to go on the airplane in the cargo hold. If something happens to the chair while he's in Florida, Ohio Medicaid will not pay because he's in Florida. Let me find out if there's any kind of a reciprocal relationship with a wheelchair manufacturer or vendor, that's the word, vendor in Florida. I never thought of that. Nick flew to Florida, wheelchair went in the cargo hold. When he got to Orlando, the caregiver called me, said the power box, the joystick has been bent so that if Nick pushes the joystick and he thinks he's going straight, he's doing wheelies. I said, oh my God. I said, what do we do now? The caregiver said, Nick said I can operate the chair. I said, okay, fine. The seat is ripped, the back is ripped. We reported it. They don't want to talk to me. They want to talk to family. I said, okay, who wants to talk to you? I got to talk to the manager of the Orlando airport, the manager of the Cleveland airport. And what they told me was, can he use the chair while he's in Florida? Yes, he can. When he comes back, go to baggage claim and file a claim with the airlines. Yes, it's insane. I know. Like I said, his chair costs more than my car. And I did. And I went to baggage claim and they said, what color is your suitcase? And I said, it's this chair. And they said, but what color is your suitcase? And I said, I'm claiming damage to the chair. And they said, what color is your suitcase? And I said, give me a supervisor. Supervisor comes out and says, are you familiar with Miller's? I said, yes. Miller's is who made the chair and makes the repairs. And they said, call Miller's. We have an open contract with them. Now, what scared me more? Who wrote the thing? Kelly, what scared me more was not the damage, but the airlines have an open contract. Yes, they did. And I will tell you that local recent literature indicates that power chairs often get damaged. Not even power, wheelchairs often get damaged by airlines. So anyway, what I want, yes, a wheelchair contract. Can you believe it? Anyway, so personal strengths, this is what we're looking for. We went through the 5 areas. Oh, also think about for relationships, not just people you know, but do you know anybody who has information? Or do you know anybody who knows anybody? Do you know anybody who has ICE, information, connections, or experience? What I want you to do, hold on, let me just take a half a minute here. Okay. We also we sent you this chart. It's integrated support options. On the left, you see the 6 domains, well, 4. On the other side, it's a 2-page chart. The other page has the 2 domains plus supports for the family and integrated supports. So each domain going down across the top are the 5 areas from the integrated support star. So it gives you things to think about. If you're blanking, like, what are they talking about? Here are things to think about, to consider. What I want you to do, we're going to go in breakouts in a minute. I will share this screen to the breakouts. You can send them, Erica, if you have the breakouts set up, they can go to the same breakouts, or we can make them bigger. We can put, let's see, we could put like 8 people in a breakout. You tell me what will work. I don't care, whatever works for you.
Let's do the 8 people and see how that
Okay.
does. Because we're kind of dwindling down on people, so.
Okay, so what I want you to do is pick a goal that I have listed or one that you're working on. And as a group, go through the integrated support star, not the eligibility specific, but the other 4 areas, and just brainstorm possible resources and supports. And I will share this screen to the breakout. So Erica's going to send you an invitation, accept it, and go into your breakout rooms. Give them 6 minutes, Erica. Yeah, I know,
Hey.
we're both reaching for our phones.
Okay. I'm opening the rooms now. You should see it an invite. Please accept it.
Thank you, Erica.
Mhm.
Erica, I can't share I don't think I can share it. Well, let me see, okay? If I can share it while you're,
Okay.
let me see if it'll go to breakouts.
Should.
Oh, I should have done just the slide. Okay. Supposedly they should see it. You are screen sharing to breakouts.
Cool.
Okay, thanks.
Mhm. As
So
for the
you,
rest of you that, oh, go ahead, Barb.
no, you go ahead.
As for the rest of you that's still with us right now, is anybody having issues that didn't see an invite or wants to put it in chat? I can get you into a breakout room. I'm gonna start moving some of you. If you don't accept it, I'm gonna do a screenshot of the ones that didn't participate. So speak up or put in chat if you could. Thank you. What'd you say, Barb? I'm sorry.
No, never mind. It's okay.
You good? Okay, sorry.
Thank you, though. Thanks. Okay, people are talking. Yeah, there we go. Yep, yep. Awesome. Okay.
And Barb, I'm just FYI, I'm gonna put of course, the evaluation in the chat and also have you, both of us announce it, or whatever. I don't want to trust it when they leave because I don't know how I forgot or maybe whatever, but I did in the beginning. I put it in the Zoom thing, but I don't want to trust it because that's been kind of faulty. Yeah, even though I saved it like twice in the very beginning, so I just want to have them all do it through chat just to be safe.
Okay, so when I get to the end, I will try to remember to turn it over to you too. So,
Okay,
okay.
no biggie.
Thank
I'll
you.
yell at you and be like, "Let me speak, Barb."
Yes, do it. I don't care. It's all good. Ay, 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 ay. And it's a minute.
I got 3 minutes of mine, but I was putting people in.
Yeah, no, it's a minute. So you can give them the notice. Okay, people are coming back, so we'll give you probably another 30 seconds, I think.
Ability using, they had their parents' cars, so, yeah.
And here people come.
All right.
Okay, so I know you couldn't solve this in 7 minutes or whatever, but what I love about putting people in rooms to brainstorm is that somebody comes up with something that somebody else in the group will go, I never thought of that. And that's the power of just brainstorming. What's out there? These are all true stories. The person about writing a book about my story, the service coordinator said, let's go to the library and learn about writing your own book. librarian said, there's a group of self-published authors that meet once a month at a coffee shop. Let me reach out to them. Let me find out when they're meeting and let me share the information with you. If you don't ask, you don't know. I just thought, what a cool idea, connecting him to a group of people that have a similar passion and, the provider providing the transportation. But I hope over time, somebody said, where do you live? I can take you home. So you're making those connections, teaching people about disability. The service coordinator, the SSA, said, I went to the community college my first 2 years. I had a history professor I love. Let me reach out to him. Let me see if he can help us. Set up a meeting, met the gentleman, met the professor and the SSA, and the gentleman and his provider went and met. The professor said, oh my God, would you guest lecture at my class about disability history? And the guy was like, yeah, I'd love to. And he goes, can you share your PowerPoint? And the young man went, my what? And the provider said, okay, I know what we have to work on. Driving a car, all sorts of programs, sharing my passion for trains. I said, I have a friend who's a train geek. He belongs to a train club. Are there any train clubs? Has the person ridden the Cuyahoga Valley train? And they were like, I don't know. I said, well, that's a train that's in Cuyahoga and Summit County, and it goes down along the national park. So it's supposedly a beautiful ride. And at Christmas, they do the, oh my gosh, what's the movie with Tom Hanks? That's a kid's movie.
Polar Express.
Thank you, Polar Express, thank you. And they have Polar Express, trips. So, has he ever done that? Working with children, can they volunteer? We had one woman who used a device and she read stories. She and her family programmed children's books into her device, and she would read the book to kids at the story time. What are the possibilities? Don't just think narrow. So I love it. I think it's fun. Start with personal strengths, end with eligibility. This is when you want a group of people talking, so this is something you might do in a team meeting. Or I've even told SSAs at your department meetings, share if you're stuck. How do I help somebody do this? Anybody got any ideas? One girl wanted to raise, I forget what animal, show it at a county fair and learn how to butcher it. Ooh. And the poor SSA was like, I don't know anything about this. And all these other SSAs were like, is she part of Future Farmers of America? I don't know. And she was just like, this is so out of my realm. But the SSAs, it was a county that's pretty rural. And the SSAs knew because their kids are part of those programs. So the SSA was like, I can't write fast enough. She was just like, I never heard of these things. So what we want to see is that you really do brainstorm and think, and it also helps staff learn about what are the resources in the community, not just what can we provide, but what's available. So whenever you use any of these airlines not good. Oh, you only had 6 minutes. I apologize. What can I say? So whenever you use any of these tools, always know why. Explain to the person, this will help us think about other possibilities. This will help you organize your thoughts, whatever it is. Explain it. Know that you don't have to use a specific tool with everybody, and you don't have to use all the tools with one person. It's pick what will help you. And whatever, if you are using any of the tools and writing down, please know that the paper belongs to the person. Keep a copy for yourself. families, people with lived experience say, I have it written down, I have paper power, I have paper courage, and those are their words. So make sure you give people the paper. So I've talked about all of your functions. I covered these resources, the one page, the trajectory, the vision, the integrated STAR, the integrated support options, the experiences and questions booklet, the 4-pagers, 7 resources. I want you to think about in the next month, which one do you think you might use? No more than 2, because everybody will say, oh, I'm going to use all of them. No, you're not. Think about 1 or 2 specifically. You're thinking this might help somebody on my caseload, or this might, yes, all the parts are useful. You got, and you can pick from whichever ones. There's no mandatory. Okay, so which one do you think you might? And that's poll 8, Erica, sorry. Yep, yay. Awesome, all over the place. I love it. I love it, because one does not, you know, one tool does not fit all, even though I have my personal preference. I'm so glad. I'm so glad. Thank you so much. And I hope you're all over the place because you're thinking specifically, you know, this would be helpful for somebody I'm working with, or this would be helpful in this situation. So please, if there's anything we could do, we're happy to share information with any group. You know, please contact us. You can go to frnohio.org. We have a contact tab. Let us know if we can share with any kind of a group. We're happy to share with any group. And I'm going to turn it over to Erica for a minute.